Hi, my name is Erin. I'm going to be the student nurse practitioner assessing you today. Can you tell me your name and date of birth?
Faith Evans, 2/6/2000.
Good. How did you get here, Faith?
I drove myself.
Okay. Did you have any issues finding the facility?
No.
Okay. What brought you in today?
I have an earache.
Okay, I'll take a look at your ear here in a few minutes, but we're going to do a full head to toe assessment, and once we get to your ear, I'll ask you some questions about it, but are you okay with doing a head to toe assessment?
Yes.
Okay. To start out with, I'm going to be inspecting your general appearance. I'm seeing a Caucasian female, probably in her mid-20s, not looking like in any distress or any severe pain, seems to be calm, cooperative, and okay with doing this assessment. To start out with, I'm going to be assessing your head. I'm going to actually have to touch your scalp, look in your hair, make sure everything is okay there. Are you okay with that?
Yes.
Okay, I'm going to put on some gloves. So with your ear pain, you can go ahead and tell me when did the pain start?
2 or 3 days ago.
Okay. Have you ever had ear pain before?
No.
Is it in the left ear or right ear?
Right ear.
Okay. Is there any drainage coming from the ear?
No.
Sorry, my hand sanitizer is making these gloves sticky. There we go. Okay. I'm going to go ahead and just on general inspection of your face, I'm seeing no asymmetry, no drooping. Eyebrows look to be symmetrical. Eyes are symmetrical. No bumps, bruises, lesions. I'm not seeing any infection or redness looking, so I'm going to now inspect your scalp, okay? At any point in time, tell me if it's hurting you. Upon inspection and palpation of the scalp, I don't feel any lumps, bumps, bruises, nothing that seems abnormal. Are you feeling any pain?
No.
Okay. Looking through the hair, I don't see any dryness or flakiness, no patches. Everything there looks fine. I don't see any pattern loss. Your hair looks to be very full and thick, so that's good as well. I'm going to go ahead and inspect cranial nerve 7. So can you smile for me? Good. Can you puff out your cheeks? Puff out your cheeks. There you go. I know it's a little weird. Okay, patient was able to puff out cheeks. I didn't see any asymmetry with that as well. We're going to go ahead and palpate. We are palpated. I'm sorry. I'm going to auscultate your temporal arteries, okay? Can I take your glasses off? Can you hold this? Okay. Any pain?
No.
I don't feel any bulging or any abnormal sensations there. I'm going to go ahead and auscultate and listen for bruise. Bruise are kind of a weird, kind of whooshing noise, but it's an abnormal noise that we would not want to hear, okay? I'm going to be using the bell of the stethoscope. Okay, no bruise heard. No bruise heard. Good. Okay, now I'm going to inspect your neck. Upon general inspection, I do not see any swelling. I don't see any abnormal lesions, contusions. That all looks fine. I'm going to go ahead and palpate. I'm going to be looking for your, or palpating for your lymphatic system, okay? So I'm going to be looking for any swollen lymph nodes. I'm going to start first with the preocular, post-orcular, occipital, tonsillar, submandibular, submental. I'm going to go down the cervical, so we have the supracervical, post-cervical, and then the deep cervical. Any pain or tenderness upon that? And now we're going to go to the supraclavicular, and that's going to be the last one there. Okay, I didn't feel any swollen lymph nodes, so that's good. I'm also going to assess for range of motion. So look down, look up, look to the left, look to the right, kind of roll your neck for me. Okay, any pain? I heard your neck pop, but no pain. Okay. Let's see. I'm going to also inspect your trachea. So upon inspection, I don't see any deviation to the left or the right. I'm going to go ahead and palpate it. I don't feel any deviation there, which is good. I'm going to come from behind, and you're going to actually swallow while I'm touching it. Okay. Go ahead and swallow. Okay. Any pain upon swallowing?
No.
Okay. In there. I just want to make sure we inspected that. Your thyroid gland was not overly swollen. That's good as well. We always want to take a look at that. Okay, we're gonna move on to your eyes, okay? So I can see that you wear glasses. Do you wear contacts also?
Sometimes.
Okay, just upon inspection of the eyes, I see no asymmetry. Eyebrows look fine. I don't see any lesions or any bumps, bruises. I don't see any infection. Your conjunctiva looks very clean and crisp. So that's good. And we haven't had any severe issues at all with our eyes. Okay, we're gonna go ahead and do a eye exam. So I'm gonna do a visual acuity. I'm gonna stand, let's move this bed back just a little bit. Just a little bit. There you go. I think that should be okay. Okay. There we go. You can go ahead and sit down. Okay. I'm gonna stand about 6 feet away from you. Okay. I need you to read this bottom line for me. We're gonna cover your left eye first. Okay, go ahead and read it to me.
LTFPH.
Okay, go ahead and do with the right eye.
LTFPH.
Okay, and now both eyes.
LTFPH.
Okay, you were 20/20, so that's good. That's what we needed to see. I'm also gonna do what's called a cover and uncover test. So I'm gonna be looking for what's called strabismus or deviation. So we're gonna be looking to see, I'm gonna cover up one eye and we're gonna look to see if that other eye does any movement, okay? So you just stay right at me. Okay. I did the same thing. I do not see any lagging or deviation on either side, which is good. We don't want to do that. Okay, that's called the cover and uncover test. We're going to now check for perla. So I'm going to be shining this light in your eye. I'm going to be looking for accommodation of your pupils. So I'm going to be looking to see how they react to light, if they are the same size and movement at the same time, and if they're in the same placement. Okay, so just look straight at me. Okay. We have positive perla, so that means that eyes are reactive to light and have no issues there. I'm also going to check for accommodation, so stare right at my pen and then pick a point on the wall behind me to focus on and then go back to the pen. Yep, accommodation was there. Now we are going to do an actual eye exam. So I'm going to be using this to take a look in your actual eye. It's going to be kind of a bright light, but I'm going to be looking for your optic disc. I'm going to be looking at your retina to make sure your retina is intact, and I'm also going to be looking for your red reflex, okay? Oh, it'll turn on. There we go. Okay, a little bit of a bright light, okay? I see the red reflex, I see your retina, and I see the optic disc. Sorry, I know that's a little annoying. I see the retina, I see the optic disc, and it looks like red reflex is all intact as well. So awesome. You can put your glasses back on. Okay, I'm also going to do another exam where you're going to cover your eye. It's called, the test itself is going to be looking for, oh my gosh, I'm so sorry. Thank you. Visual confrontation of all fields. So you're going to cover up one eye, either your left or your right is what we'll start with your right, or left, sorry. You're going to cover up your left eye, and what you're going to do, I'm going to, in all visual fields, I'm going to be either putting up 1 finger, 2 finger, 3 fingers. You're going to tell me when you see it. So cover that eye completely. And this is going to be testing for peripheral vision, okay? So tell me what you see.
2 fingers.
Yeah, and just stare at me, okay?
1, 2, 1.
Okay, go ahead and do the other eye.
2, 1, 2, 1.
Sorry. Patient was able to see all numbers and they were correct in each field. Now we're going to do what's called the Hirschberg test or the corneal light reflex. So I'm going to take this light, just look straight at me. I'm going to be looking for, I'm going to shine it right up under your eye, but I'm going to be looking for the light that reflects off of your pupils. They should be in the same place in both eyes and have the same movement, same amount of light. Okay, so just stare right at me. Yep, okay. And then we're going to do the 6 cardinals field of gaze. So what that means is I'm going to make a H kind of pattern. You're going to stare straight at me, but when you are following the pattern, following where my pin goes, you're only gonna be looking with your eyes, so don't move your face, just look straight with your eyes, okay? And just follow where the pin goes. Okay, correct. All right, now we're gonna move on to the ears. So you were saying it was your left ear, correct, that hurts, or
Yes.
right ear?
Right.
Was
It's
it
the right ear.
It was the right ear, okay. That's fine. I just wanted to make sure. I'm gonna go ahead and take a look. And before I even take a look, I'm actually gonna do what's called a hearing exam. So we're going to do, I'm gonna look at your ear, but then I'm gonna do a gross hearing exam, and it's called the whisper test. I'm actually going to stand behind you. I'm gonna whisper 3 words on the right side, 3 words on the left side. You'd have to repeat them back to me, okay? But upon general inspection, I'm not seeing any swelling of the auricles. I'm not seeing any redness. I'm not seeing any lesions or cuts or swelling, no flakiness. I'm gonna go ahead and stand behind you. Just let me know what you can hear.
Dog.
You have to repeat it.
Dog.
Bird,
Bird.
doctor,
Doctor.
cat,
Cat.
bird,
Bird.
person.
Person.
Patient was able to repeat words back to me while whispering, and I could hear them and she could hear me. Let's go ahead. And that was for cranial nerve 8. So we're going to now do what's called the Rennie and Weber test. So I'm gonna use this tuning fork. I'm gonna activate it, and I'm gonna put it next to your ear. We're gonna do both sides. You're gonna tell me if you can actually hear the vibration, and then I'm gonna actually put it up against your bone. It's called bone conduction, and you're gonna tell me when the noise goes away. So you'll listen to it up until it goes away, okay? But we'll go ahead and get started. Can you hear it?
Mm-hmm.
Tell me when you can't hear it anymore.
I can't hear it.
Were you able to hear it when it first touched? Okay. Can you hear it?
It's going away.
And now we're gonna do the Weber test, so I'm gonna do the same thing, but it's gonna go in the middle of your head, and you're gonna tell me if you can hear it on one side more than the other, or if you can hear it equally, okay?
Equally.
You can hear it equally, okay. Awesome. All right, next is going to be, I'm gonna change my gloves because those are actually ripped. Let's see here. And then the next thing we're gonna do is the actual otoscope exam. So I'm gonna actually look inside your ears, and I can take a look and see if you have any redness or anything going on inside your actual ear. My gloves are sticking to my hands. Like terribly. That hand sanitizer made my hands sticky. I'll fix it in a minute. It's okay. It's fine. I'm so sorry. My hands are sticking so bad to this. I know, I'm sorry. It's making it worse too. There we go. I think we finally got it now. Okay. I'm gonna go ahead and look in your right ear. Okay. Tell me if anything hurts. Okay, I was able to see, that was your left ear, I was able to see the tympanic membrane in there, and it was a gray pearl color, which is what it's supposed to be. This is the right ear. Okay, I was able to see the pearly white eardrum, but it also looked like there was some redness in there, okay? I didn't see any discharge, I didn't see any over earwax in either or, which is good. But I did see some redness in the right ear, okay? And you said that was where you were hurting it. It's been going on for 3 days.
Mm-hmm.
And right now, what is your pain on a scale of 0 to 10?
About a 5.
Okay. Next thing we're gonna do is look at your nose. Yay. Any issues with your nose?
No.
Okay. Upon general inspection, oh, I'm sorry, my hair got my face. I don't see any deviation, any breaking of the nose. You've never broken your nose in the past, right? No severe injury. Can you take your glasses off for me for just a minute? Okay, I'm gonna palpate right here. Does this hurt at all?
No.
Okay, I'm gonna go ahead and palpate your sinuses. Maxillary sinuses, no tenderness. Frontal sinuses, is there any tenderness?
No.
No tenderness in either, okay. I'm gonna go ahead and look up in your nose. This will turn on. Go ahead and look kind of up for me. Okay. All right. I don't see any deviation of the septum. The septum is intact, no drainage of any nature. I'm gonna go ahead and do what's called a smell test. So it's gonna be cranial nerve 1. So if you will, go ahead and close your eyes. When you do, I'm gonna put a scent under your nose, and you're gonna tell me what you can smell. If you can though, we're gonna check one nostril at a time. So go ahead and close your left nostril. Okay, what do you smell?
Cinnamon.
Okay.
Cinnamon.
Okay, patient was able to smell, so cranial nerve 1 is intact. We're also gonna do now what's called the finger to nose exam. So I'm gonna be moving my finger around. You're going to touch your finger to your nose and then staring at me, touch your finger to your nose and then touch your finger to my finger. Does that make sense? Okay, and whenever it moves, you're gonna like go back and forth to each one, okay? Go ahead and start. There you go. Try to go as fast as you can, and I'm gonna get a little bit faster. Awesome, okay. We're gonna go ahead and inspect the mouth now. So I'm gonna change gloves one more time because I am at one point, I'm going to be actually feeling inside your mouth, okay? For any bumps, lesions, any cuts, anything of that nature. Do you have any ulcers in your mouth currently? Okay, we're gonna go ahead before I do that. Okay, just upon inspection, I'm looking at your lips. Lips are pink. They are moist. They don't look dry. There are no lesions. There's no ulcerations that I'm noticing. So that'll be good. I'm gonna go ahead and look inside your mouth. Actually, I'm gonna go ahead and just inspect it first. Here we go again. These things. Okay, I'm gonna do what's called a through and through test. So I'm gonna look in your mouth, but then I'm also gonna actually palpate. These gloves not wanting to work with me today. Okay, go ahead and open your mouth for me. Okay, I'm gonna look inside. All right, looking inside, I don't see any dental caries. I don't see any lesions. Tongue is intact. I don't see anything like thrush or any ulcerations. Go ahead and go ah, like put your tongue down for me. Okay, go ahead and swallow. Okay, I don't see any swelling of the tonsils either. Have you had any issues with your tonsils? No. Okay, I don't see any issues there. I also saw your uvula whenever you swallowed. It was midline where it's supposed to be. I didn't see any issues. You didn't gag. You didn't seem to have any issues with swallowing. So that's all good as well. If you'll open your mouth, I'm gonna go ahead and feel. So feeling inside her oral mucosa is moist, it's pink. I don't feel any ulcerations, no pain in your mouth?
No.
Okay. What you're gonna do now, let me take this off, but you're going to take your tongue, so with your mouth closed, you're gonna take your tongue and push your tongue to the left side of your cheek against my hand and do it over here. Okay, awesome. Patient's tongue had good strength, good movement, so that was all great. And then now I'm gonna actually assess for TMJ. So I'm gonna put my hands right here, and I need you, if you can, to move your jaw back and forth. Okay, I don't feel any clicking, no clicking, knocking, or crepitus. You don't have any issues with TMJ or history of TMJ? Okay. Next thing we're gonna move on to is your cardiac exam. So upon observing, your breathing is not too shallow, it's not too deep. You don't seem to be having any use of accessory muscles, which is good. I'm not seeing any asymmetry. Your AP ratio, which is your chest to diameter ratio, looks to me to be, can you go and lift your arm up for me just a little bit? Yep, it's 2 to 1, which is what it's supposed to be. So your chest is supposed to be a diameter of 2 compared to your side, which is a ratio of 1. So that's good. I'm going to palpate and feel for any crepitus, which is like kind of crackling, bubbling noises. We don't want any of that. I'm going to be feeling for pain, and then pain and tenderness, and then I'll be listening to you, okay? Okay. Any pain?
No.
Okay. I'm going to go kind of up under your breast right there. No pain or tenderness. I'm gonna go to your back. Okay, no pain or tenderness or crepitus felt on the patient's chest or back. I'm gonna go ahead and okay, sorry, I'm gonna go back here one more time. All right, go ahead and breathe like a normal breath for me. Okay, symmetry was correct in that and not having any issues. Okay, next thing I'm gonna do is actually percuss. So I'm gonna be kind of knocking in certain areas along your chest, okay? Tell me if you feel any pain.
No.
Okay. Upon percussion, I'm not feeling any areas of dullness or any areas of possible fluid accommodation. No pain here?
No.
Okay. While I'm back here, I'm gonna go ahead and check for what's called a CVA tenderness, so that would be like above your kidneys. I'm just gonna tap my hand, tell me if you feel any pain, okay?
No.
Okay.
None.
Okay. No pain, no CVA tenderness. I'm now gonna go ahead and listen to your lungs, okay? So just take normal deep breaths for me. So I'm gonna go into your breast a little bit. Okay. Breath sounds heard in all fields. I did not hear any adventitious breath sounds. Everything sounded normal. There was no crackling, no rhonchi, nothing of that nature, which is good. We're gonna go ahead and do the same thing on the back. And then I'm also gonna be doing a test, checking for what's called tactile fermentus. So we'll go through that in just a minute, okay? Also, while I'm listening to your lungs, here in a minute, we're gonna do another test too. It's gonna be checking for consolidation. So you'll be making a few noises, they're like E noises, and I'll tell you whenever we get ready to do that, okay? But first, I'm just gonna listen. I was able to hear breath sounds in all lung fields. I did not hear any wheezing, bronchi, no adventitious breath sounds. All lungs were clear, bilateral. And let's see. Okay. Yes. Okay. So I'm touching the back right here. Whenever I put my hand right here, I need you to say 99.
99.
I'm gonna do it again right here.
99.
And again right here.
99.
Okay. That was checking for consolidation, so you did not have, if there was a difference in vibration, like as I was going down your lungs, I would have been concerned that you either had fluid or consolidation in your lungs, okay? Next thing we're gonna do, so we've already assessed lungs, we've checked for CVA, tenderness, egophony. That was the test I was gonna tell you about. So whenever I place my stethoscope, every time I place my stethoscope, you're gonna say E, and what I'm gonna be looking for when I'm listening is if the E sound turns to an A sound. That's also another assessment for consolidation. So go ahead and say E.
E. E. E. E. E. E. E. E.
Okay, good. I did not hear any of the sounds change over to an A sound, which is good. That means your lungs are clear bilaterally. You're not having any consolidation, no fluid buildup, nothing of that. Okay? Next thing we're gonna do now, I'm gonna go ahead and lay you back, or you'll lay back to kind of a 30-degree angle. I'm gonna lay you back a little bit more. And we're gonna listen to, I'm gonna palpate, but also listen to your heart. You can go ahead and lay your head back. Okay. Upon inspection, breathing looks to be at a normal rate. You don't seem to be anxious. You are denying chest pain. Okay. No chest pain. I'm gonna go ahead and palpate for what's called your PMI. Okay. So I'm gonna be just checking. It's gonna be mid-clavicular, midline, at 5th intercostal space. It's kind of right up under your breast tissue, but I'm gonna be feeling just for your heart. I was able to palpate it just barely, but I can feel it, which is normal. That's fine. And it was at a normal rate and rhythm. And then here in a minute, I'll actually check how many beats it is. Let's see. Okay, I'm also looking at your neck. I'm not seeing any JVD, which would be jugular vein distension. We don't want that at all. That would be indicative of a cardiac circulatory issue. And I'm not seeing any JVD on that side as well. Okay, and then we're gonna go ahead and auscultate. So I'll be listening for to multiple arteries and valves, okay? And we're gonna be listening for the bruits. So I'll listen for your normal breath, or for your normal cardiac sounds, but then I'm also gonna be listening to the bruits again, which is the swooshing noises that we don't want, which I'm not anticipating that you'll have any, but go check them anyways. Okay, just breathe normally. Okay. I'm listening to the aortic, the pulmonic, Erb's point, tricuspid, and mitral. I did not hear any bruits. I'm going to now switch over to the diaphragm and listen again. Okay. To the aortic, pulmonic, Erb's point, tricuspid, and mitral. I was also able to hear S1 and S2, and those were normal. I didn't hear any adventitious sounds. I didn't hear any bruits. And now I'm gonna actually listen for your apical pulse, okay? And it's gonna be for 1 whole minute. So we're gonna go ahead and start now. Okay, your apical pulse was an even rate and rhythm, and it was 61 beats per minute. Okay, next thing we're gonna do, okay, I'm gonna go ahead and have you sit up one more time at the bedside, and we're gonna test for range of motion. So what I would like you to do is put your hands straight out. I need you just to open your hands like this, back and forth, pull your wrist up and down, side to side, move your arms out to side, up, down, any pain, any clicking. I'm gonna go ahead and feel. Upon color of the skin, it's looking normal for patient's race and ethnicity. I'm not seeing any bruising or scars. I'm gonna go ahead and take a look at her nails. Nail beds look to be pink. Cap refill is less than 3 seconds. Any pain in your hands and joints? Okay. Next thing we're gonna do. Okay, I'm gonna go ahead and assess for your upper extremity pulses, and then there's 2 more lymph nodes that I'll be checking for as well. Okay, I'm gonna do radial pulses. Radial pulses are +2, felt bilaterally. We're gonna go brachial. Brachial pulses are felt and they are equal bilaterally +2. I'm also feeling for the epitrochlear lymph nodes, and I do not feel any swelling of the lymph nodes. If you lift your arms just a little bit, I'm going to feel your axillary lymph nodes. Okay, and I don't feel any tenderness, or not tenderness, but I don't feel any swelling, and there was no tenderness in any of those areas. Okay. Okay, your skin looked good, cap refill was good, there was no clubbing or cyanosis noted to your skin, meaning that you've got good peripheral blood flow, which is what we want. I'm gonna go ahead now and, let's see. We'll check your lower pulses here in a few minutes, but I'm gonna go ahead and do your abdominal exam, okay? So if you'll lay back one more time. I'm gonna lay you back pretty flat, okay? I'm actually gonna lift the bed up just a little bit just so I can be a better working height. Okay, upon general inspection, I'm not seeing any bulges. Stomach, it looks to be very flat, which is good. Don't see any umbilical hernias. Sorry, there we go. And then I'm going to go ahead, upon inspection, I'm going to listen next. Okay, so, right, yes, I want to make sure. Oh, I do need you to do one thing. While you're laying flat, will you lift your head up for me? Good. Upon patient lifting her head, I don't see any abdominal bulging, any abdominal hernias, or umbilical hernia as well. Good. And then we'll go ahead now. I'm going to listen to all 4 of your quadrants for bowel sounds, and then I'm going to listen to your arteries as well. Okay. Same general thing. Going to be looking or listening for the bruits and listening for good pulses. I'm going to start with the right lower quadrant. Right upper quadrant. Left upper quadrant. And left lower quadrant. Okay. I was able to hear bowel sounds in all 4 of those locations. I'm now going to listen to your arteries, okay? We're going to start with the aortic, the left iliac, or sorry, left renal, right renal, right iliac, I'm sorry, left iliac, right iliac, femoral, and right femoral. Okay, I was not able to hear any bruise, which is a normal finding. Okay, I'm going to percuss now. So whenever I percuss, I'm going to be kind of tapping my hand on all the quadrants, okay? We're going to be looking for dullness or any abnormal sounds. So when I get to your liver, we may hear a little bit of a kind of a dull noise. That's normal. We may even hear a little bit of dullness on the side where your spleen is, okay? Tell me if anything hurts. Okay, I was able to hear a little bit of dullness over the liver, and I'm gonna listen now and do what's called a scratch test, okay? I'm gonna be looking for the liver border. So you're gonna feel me scratching with my finger on your skin, okay? Okay. I was able to find the liver border. It's about 6 to 8 centimeters, which is normal. This is where it should be. And now I'm going to actually palpate. So I'll be doing what's called a light palpation and then a deep palpation. If anything hurts when I'm doing that, please let me know. Okay, light palpation. Now we're going to do a deeper palpation. I'm not feeling any abnormal swelling. I'm not feeling any nodules or any bruises. I'm not seeing any lesions. Okay. Any of that hurt?
No.
Okay. Let's see. All right, and I was not able to feel your liver or your spleen, which is good. We're not supposed to. If they're abnormally swollen, then I would have been able to, but spleen is on this side. I was not able to feel it, and I'm pushing down pretty hard, and then your liver, I was not able to palpate either. Okay. All right, and next thing we're gonna do is your musculoskeletal exam. Actually, before I do that, I'm gonna feel for your lymph nodes that are in your groin, okay? So just right here, I'm not feeling any swelling in the lymph nodes. Okay, and no pain or tenderness? Okay. Now what we're gonna do, I'm going to inspect your your lower extremities. I'm gonna be looking for swelling, edema. I am gonna have to take your shoes off and look at your feet as well. And then we will get into the bottom half of the exam where I will be actually moving your legs around and doing range of motion exercises, okay? So I'm gonna go ahead and take your shoes off. I'll let you put them back on in just a minute. Just kidding. Okay. All right, upon assessment of the legs, I am not seeing any swelling. Skin looks to be clean and intact. I'm not seeing any lesions. Is there any pain or tenderness when I'm squeezing right there? Okay. Feet look, let's see. I don't see any swelling in the feet. All toes have a cap refill less than 3 seconds, which is normal. Nail beds are clean, they're pink. Temperature is good. You're not cold, but you're not hot either, so that's good. Let's go ahead and have you sit up. Where you sit up, sorry. I'm gonna go ahead and lower this back down. I don't want you to fall. Okay, you can go ahead and sit up to the edge of the bed for me. Okay, so we're gonna do range of motion exercises. So I'm gonna check your shoulders. If you will lift up against my shoulder or my hands. Good, okay. Any pain upon that? No. Okay, we're gonna do, so we did that. Okay, go ahead and try to put resistance against my hand with your cheek. Okay, and go ahead and turn, kind of turn like that. Good, sorry, I should have been trying that way. There you go, sorry, it's a little strange, but I'm checking to see if you have any abnormalities in your muscles, in your neck, in your face. Okay, we already did range of motions with your hands, which was good. Let's go ahead and do strength test. So you're going to, with your hands, I want you to push down against my hands. Okay, push up against my hands. Okay, you can go ahead and we're gonna do same thing with your forearms. You're gonna try to push out against me. Okay, pull in, good. In a minute, I'm gonna put my hands right here and you're going to pull up against me, okay? Pull up, okay, push down, good. Put your arms out to the side like that for me. We're gonna do the same thing, push against me, okay, pull against me. There you go, good job. All of that was equal. We're gonna do what's called a rapid movement test now. So you're gonna take your hands and you're going to start kind of slow and then work your way faster and faster, as fast as you can go. Good, that's all intact. Okay, we are now going to Okay, we're doing another thing called serogenesis. So you're gonna close your eyes, I'm gonna put an object in your hand, we're gonna do left hand, right, you're gonna tell me what it is that you feel, okay? Go ahead and close your eyes. What do you feel?
Pen?
Yep. Okay, give me 1 second. Sorry, give me just 1 second. I forgot one of my objects over here. There we go. Okay, I'm gonna put it. We're gonna do this hand again. Sorry. Here's second object. What do you feel?
Ring?
Yep. Good. Now we're going to do your next hand. Keep your eyes closed. What do you feel?
Ring?
And now what do you feel?
Pen.
Good. All right, you can open your eyes. Let's see. We looked for edema, we saw all of that. Okay, we're gonna go ahead, I'm gonna have you lay down again. We're gonna do range of motion. I'll let you sit up just a little bit. There you go. Okay, go ahead and bend your knees for me. We're gonna do range of motion of your knees and your hips, okay? So I'm gonna pick your knee up and move it. No pain or tenderness. No pain or tenderness. We're gonna do your hip now, so I'm gonna bring your leg up and then I'm gonna pull your hip out a little bit. Okay? Any tenderness?
No.
Okay, no tenderness. All right. Next thing we're gonna do, we're gonna test strength. So I want you with this leg, I'm gonna pull this up, push your hip, try to push it out against me. Yeah, you're strong. You're strong there. Jeez, that knocked me over, I wasn't expecting that. Okay, good, strong there. We're gonna do the same thing with your knees, okay? You're gonna lift your leg up and try to push your knee up against me. Kind of force it, yeah. Do the same thing. Yep. You had equal strength in both legs, so that was expected. We're gonna do now what's called the Lakeman's test, and it's gonna be testing for your ACL. So you're gonna relax and just let me do the work, okay? I'm gonna kind of pick up your leg like this, and all I'm gonna be doing is feeling I'm feeling for any clicking or any kind of rocking or sliding, okay? And I should not feel anything. No pain?
No.
Have you ever had any knee surgeries or anything? Good. Okay, next test we're gonna do is the McMurray test. Yes, McMurray test. So what I'm gonna do is hold your knee up. You're going to, I'm gonna push I'm trying to think how to describe this. So I'm gonna be twisting your ankle at the same time that I'm gonna be moving your knee, and you're just gonna tell me if you feel any pain, okay? Any pain?
No.
Okay. I didn't feel any resistance, I didn't feel any knocking. I do the same thing. Any pain or tenderness? No. Okay. All right, and then now we're going to do the athlete's test. So this is gonna be for ACL and PCL. We're gonna be looking again to see if we have any clicking, any uncomfortableness. I'm gonna be doing what's called, it's gonna be like a push and grind kind of method. So I'm gonna push your foot back and kind of grind. I'm not feeling anything in your knee, any pain in your knee. Same thing. Okay, did not feel any resistance or clicking. Last thing we're gonna do, you're gonna relax your leg. Actually, no, sorry, you're gonna put your leg there. I'm just gonna pull against it. You just keep yourself as still as possible. I'm gonna push against it. This is also testing ACL and PCL. I'm gonna pull, I'm gonna push. I didn't feel any resistance. Okay, you can go ahead and stand because we're kind of getting to the end of our assessment. So what I'm gonna do, we're gonna do a few more reflexes and then I'm gonna watch you walk. Nope, sit down please. Sorry, it's okay, it's okay. All right, do what's called heel to shin. So you're going to run your heel down your shin on both legs. Awesome. I'm gonna go ahead and check for your pulses and reflexes. So I'm gonna check for your popliteal pulse, which it's there. Yep, +2. I'm gonna check for your Achilles pulse, +2, and your dorsalis pedis. Oh, it's a little hard. Okay, I can feel them now. Yep, they're bilateral +2. we're gonna do, let's see. I'm gonna go ahead and use my hammer to test your reflexes. We're gonna do popliteal, or not popliteal, patellar, sorry. So just let your feet dangle. Whoop. Well, there we go. Okay, I'm gonna hold your foot. You just relax your leg. Tell me if that hurts at all. Yeah. Okay, so your patellar reflexes and your Achilles reflexes were intact and normal. I'm not gonna do what's called the Babinski. So for babies, the Babinski, it will have a reaction, their toes will curl. As an adult, your toes are not supposed to curl. It probably will tickle a little bit, but just be real still. It tickle a little bit, sorry. Okay, good, didn't have any reaction. If you did have a reaction, we would be thinking that there may be some neurological things going on, but you didn't have any reaction to that, so it'd be good. If you want, we're going to stand up. Do you want to put your socks back on real quick? Okay. Because I'm gonna watch you, you're gonna have to walk for me, and then just do a couple little mobile stretches and we'll be done. Okay, go ahead and stand for me. All right, just upon inspection, I'm not seeing any abnormalities as far as, I don't see any asymmetry. I don't see one leg higher than the other, any abnormal rotation. You can go ahead and just walk that way for me. Okay, and go ahead and come back. Good. Okay, I'm gonna have you walk on your tippy toes. Just take a few steps, walk on your tippy toes. Patient was able to do that. Walk back on your heels. There we go. Okay, and then I think that was it. I just want to make sure. Oh, okay, and then very slowly I'm gonna move your shoes out of the way. Kind of walk towards that direction, but do heel to toe. So put your heel in front of your toe. There you go. Okay, you can come back over here. All right, I'm going to, if you'll turn around for me, I'm gonna look at your spine. Okay. All right, upon assessment, I do not see any abnormal curvature of the spine while the patient is standing. If you will bend forward just a little bit, I'm gonna look for scoliosis, a little bit more. There you go. I'm not seeing any scoliosis or any abnormal curvature of the spine. Okay, you can go ahead and turn around and look at me. Last test we're gonna do, I believe, I'm gonna make sure. Okay, we're gonna do some range of motion, sorry. So kind of bend to the side, bend to the side, bend back, bend forward. Does that feel tender or painful at all? I heard some popping. Okay, now you're gonna close your feet together. Okay, you're going to close your eyes. And I'm gonna watch you and observe you. We're gonna make sure that you're not falling off balance or tipping at all, which you are not. So that's good, you can open your eyes. Oh, you already did, hello. Okay, so that concludes the end of our exam. So I didn't see any abnormalities anywhere else. Your heart sounded good, your lungs sounded good. All your neuroreflexes are intact, your pulses were all intact, everything there looked fine. I did look in that ear, I didn't see any drainage. I did see that there was some redness and irritation, so we'll probably prescribe some antibiotics or and do a follow-up visit. Okay, if it gets worse or you have any other drainage or any worsening of it, then you'll follow up at the clinic. Okay, thank you.